Hey, good afternoon, everybody. Welcome to today's workshop. I think everything's coming through okay. I'm going to check it on my phone, but today's workshop is called Simple and Smart Medicare Planning, and we're going to talk all about how to transition from workplace healthcare to either marketplace or Medicare. So I think it's a very good presentation today, a very good workshop, and I really just put this together to just help you because I have so many people in this group that ask questions about healthcare planning after retirement. So I'm going to really cover almost everything you can think about what you have to do between workplace and either going to ACA/Obamacare healthcare or going over to Medicare. So ideally, this will be in here for people to watch later, but for anybody that's watching live, I want to say welcome, and I really look forward to doing this with you today. So welcome, first of all. So my name is Jason Hamilton. I'm the founder of Keep It Simple Financial Planning. And this Facebook group is designed to help you get the information that you need to transition from work to retirement. There are a lot of aspects of financial planning when it comes to just making sure you get everything in the right place. And there's a ton of information online, probably an overwhelming amount, to where you might just feel stuck sometimes. So my goal for you is always to bring it back, to keep things simple. And I think it's really good to address one subject at a time, really master that, get that under your belt, and then move on to the next, okay? So in the guide section here of the Facebook group, there is a retirement planning checklist. And this checklist is going to cover all the subjects that you need to be getting in order prior to retirement. And I believe it's on page 5, you're going to see the subjects around planning for healthcare that you need to be focused on. So if you don't have that checklist yet, please go ahead and download that there. It's 100% free, and you can use that to start checking things off of your list as you prepare for this transition. So, and over the next half hour or so, we're going to talk about some of the things that you really need to know about your healthcare planning for retirement. And so we're calling this presentation Simple and Smart Medicare Planning, Transition to Medicare, and How Health Insurance Works After You Leave Your Job. Okay. And this is a subject that can be a little bit confusing. So where we're going to start today is with this chart here. So this chart, or I should say the bars on this chart, can be seen as separate health insurance systems. You can look at them as silos potentially. So here we have employer health care, okay? Here we have Medicaid, here we have Medicare, individual health care, and then the VA. So while you're working, you generally will get your health insurance through your employer, right? So that's this bar here. This is the percentage of people that have health care through these different sources. Most people get it through their employer. But when you leave your job, you're gonna have to move to one of these other silos, more than likely Medicare. So it's going to be Medicare if you're leaving at age 65 or later, but prior to age 65, then you may have to look at some individual health care, right? So this is where it can get really tricky because then you have to worry about income and limitations and getting subsidies, and it just gets really, really tricky. So we're going to talk you through all of that today, give you some great resources on how to think about planning for this, right? So when you're used to getting your health care through one of these silos, it can be quite disrupting to have to move to one of the other silos. You get used to a whole new system of healthcare, and so that's why today we're going to talk about how to transition from employer insurance to Medicare. So the retirement healthcare challenge, it's really not as easy as you may think. Medicare generally is a system that everybody's on, but the retirement healthcare challenge can really be thought of as 3 separate and fairly complicated issues that we need to address. So the first one is, you want to make sure to make a smooth transition from your employer insurance to Medicare. This means avoiding any late enrollment penalties, avoiding any coverage gaps when you go from one insurance to another, and making sure that you have adequate coverage. Medicare doesn't cover everything, so you'll want to find the right kind of insurance to fill the gaps and cover your prescription drugs. And this is where getting a professional involved can be really beneficial, by the way. All the brokers, if you contact one of the brokers, you don't pay any more for your health care, but you can actually have somebody look at it for you versus trying to find your own plan. So that's normally what I recommend there. Okay, second, you'll want to understand your first year healthcare cost. So this could include paying for marketplace insurance yourself. This would be prior to 65, paying for Medicare out of pocket if you delay your Social Security retirement benefit. Because remember, the longer you delay your Social Security benefit, the more you're going to have for a foundational income. On average, it's about 5.5% per year of an increase in Social Security plus the cost of living adjustment you get for delaying past 62. And then past your full retirement age, which is age 66 or 67, you're going to get an additional 8% plus the cost of living adjustment up to age 70. So for those of you that may delay your Social Security retirement benefit, you're going to have to then sign up for Medicare on your own. And if you have an account like a health savings account, also known as an HSA, or a medical savings account of some sort from your employer, you want to make sure you're utilizing these efficiently. So while you're working, your insurance premiums are being subsidized by your employer. If you pay a portion of the premiums, they are coming directly out of your paycheck, so you may not be aware of how much you're even paying. But once you retire, you're basically on your own at this point. So you'll be paying the premiums yourself, and you'll need to budget for them. So we're going to talk about how to budget for them today. All right, and finally, you'll want to start thinking about your lifetime healthcare expenses, including long-term care. So as you age through retirement, healthcare costs will generally continue to rise, and you may need more care as you get older. So looking at a projection of self-insuring for long-term care or purchasing long-term care insurance is important. It will be important for you to plan for these higher expenses down the road, and you really want to do it early. If you're going to be thinking about purchasing a long-term care insurance policy, you really want to do that generally between age 60 and 63. 65 or later really starts going up. But if you're going to go down the insurance route, you want to make sure you get that insurance relatively early. If you're going to be self-funding, you want to make sure you have the right money in the right places so that you know where to pull it from if that's going to be the case for you down the road. Okay. But when you look at the retirement research, most retiree spending patterns follow what we call the retirement income smile. So let's talk about that a little bit here. The retirement income smile, something like this. So most people, when they are getting into retirement, they're generally going to be more active in the early years, okay? So we call those the go-go years, right? So most people's spending is a little bit higher. So this retirement smile is a representation of your retirement spending. Go-go years, usually spending is higher on things like vacations. There's probably some home repairs that need to be taken care of, new cars, just enjoying life a little bit more. Probably more eating out potentially, those are things that could go up. And now those are usually somewhere between your first 5 to 10 years of retirement. And then there's usually some sort of dip, and we call this the slow go years. So that's normally in most people's 70s where they've gotten a bunch of vacations out of the way. Most of the time they're hanging out now with family, spending time with grandkids, and a little bit more on the relaxed side, but they may still be doing smaller vacations, but most of the big expenses are taken care of. And then we have the no-go years, which in general, you're not as active, and that might be like your late 70s to mid 80s or even longer, where most of your spending will not be on things like vacations, but you're going to have possible things like healthcare expenses go up, and that could be like those long-term care expenses that we talked about, right? So this retirement income smile, when you look at the retirement research, this is the normal pattern people follow when it comes to their overall retirement spending. So this is how we like to plan when it comes to helping our retirees plan, because most people want to front load things like enjoying life and expenses. So again, just something to think about. It's one way to do things, not saying it's the only way to do things, but it is one way that I find to be very helpful and actually definitely aligns with the average retiree. So something to think about there, okay? Now, today, we're going to talk about how to tackle these issues. So here's our agenda for today. First, we're going to talk about how Medicare works with employer insurance. We showed Medicare in its own separate silo from employer insurance on the previous graph, but there is a little bit of overlap. And you'll want to understand how that works because it's actually really, really important, okay? Second, who needs to enroll in Medicare and when? We're going to talk about that. We're going to cover the circumstances that dictate when you need to enroll in Medicare. And then third, we'll detail how to enroll in Medicare. We'll also discuss how private insurance works with Medicare to provide complete coverage. And we're going to show you how to build a sample budget to assist you in creating your own Medicare, your own budget plan for healthcare. Okay. So our overarching message today is that people should not retire until they know how they're going to pay for healthcare in retirement. Obviously, that big checklist I give you, there's a lot of things to think about, but this is one of the main things that we want to look at. So first, let's start by talking about how Medicare works with employer insurance, okay? All right, so this table may help you understand how your healthcare benefits, how your healthcare bills are going to get paid, right? So right now, while you're working, your doctor just send your bills to your group healthcare plan, and then they get paid. Pretty simple. But when there are two insurance companies involved, such as a group plan and Medicare, then there's going to be a primary payer and a secondary payer. The primary payer pays up to its limits, and then the bill is sent to the secondary payer. So if you're still working and covered by a group health plan that covers 20 or more employees, right? So this is a very important point. If you're working and you have a group health plan that covers 20 or more employees, the group health care plan pays first. If you're also enrolled in Medicare, and if the bill is not fully covered by the group health care plan, then Medicare will pay its portion up to the limits. Okay? So here's what's important about this table, I should say. If you're covered by a health care plan that covers fewer than 20 employees, or if it's a retiree COBRA plan, then Medicare is going to pay first. This is right here, the second chart here, right? So if you are on a group plan, but it covers fewer than 20 employees, then Medicare is going to pay first. If it's over 20 employees, the group health care plan will pay first. And then from there, then the group health care plan will pay second if it's under 20 employees, or Medicare will pay second if it's over 20 employees, right? But in order for Medicare to pay, you actually must be enrolled in Medicare. And if you aren't, your other insurance may not pay its share, meaning you effectively do not have health insurance. So that's why it's important to know when you need to enroll in Medicare overall. And then the other couple here are a group plan with retiree coverage. Then Medicare would pay first, and then the retiree coverage would pay second. And then if you have COBRA, there could be some overlap there. Most people use COBRA prior to Medicare age, but there is a possibility if you have an overlap there, then Medicare would pay first and COBRA would pay second. So these are some things there that can get a little bit tricky, but the big things to know here are if you're going to be on two different healthcare plans, who pays first and who's pays second, so you know how to handle this, okay? So who needs to enroll in Medicare and when? Let's talk about the different circumstances. So if you are under 65 and still working, there's nothing yet for you to do. You will simply continue with your employer plan and you will not enroll yet. You are not eligible for Medicare until you turn 65. So most people know this, but again, I just want to make sure we're covering all the points here and we keep it really simple for you, and we're building this from the ground up so that you know exactly what to do in each stage of your life here, okay? So now, this is a little bit different. If you are under 65 and retired, you are not eligible for Medicare yet. You will have to get your health insurance from some other source. So maybe your employer offers a retiree plan, or maybe your spouse is still working and you can be covered under that plan. This is where it gets a little trickier, and you want to make sure you're maximizing your benefits to the best of your ability. If employer coverage is not available to you, you can buy health insurance on your state insurance exchange, also known as ACA plans, which means Affordable Care Act, or more widely known as Obamacare insurance. You may or may not get a subsidy depending on your income. So this is actually a tricky area to navigate depending on your situation. When you're dealing with marketplace plans, you can get a subsidy based on your reported income. Some states have higher subsidies than others, so you want to make sure you check your state. For ACA, the exchange uses your MAGI, or Modified Adjusted Gross Income, and that means all income sources count. And I have seen enough cases that I strongly recommend working with a professional if you have a large pre-tax IRA/401k, and especially if you have some money outside of your retirement accounts like taxable brokerage accounts or just cash saved up, because there are times where it makes sense to completely maximize a subsidy and get as much as you can. But there are also times where it can make sense to give up some of the subsidy to do a more advanced tax planning technique like Roth conversions, or distributing some of your pre-tax money prior to age 65 when you're in those early years of retirement. And this is more of a personal decision for some of you, okay? But another consideration here is what I like to call buying your freedom. Because I've had prospective clients come to me and see me for a financial plan, and their vision for their initial retirement years was to basically spend nothing out of their IRAs or just any of their savings, and spend most of their time at home just because they wanted to retire, and they wanted to avoid losing any marketplace insurance subsidy, okay? When in these cases, the reality is they could really afford to pay for the insurance out of pocket and also spend more money to enjoy their lives, right? So as a financial advisor, one of my jobs can be to help you spend your money as well with confidence. And we don't always know how many, quote unquote, good years that we have when we're in our peak health. And I will just say, money is not everything. The goal should not be to pass on the biggest amount of money you can. Money should be looked at as a tool that's designed to help you live your best life. And sometimes if you can afford the insurance, even if you lose a little bit of the subsidy, but you can also enjoy your retirement savings, you can maybe travel, hit some of those bucket list items early, and have that freedom. There are many cases where it can make sense to give up some subsidy for more freedom. Okay, so I will get off my high horse now, but I'm just sharing this with you because I've seen people sometimes get into almost a scarcity mindset that they just want to get maximum subsidy, spend no money, and just do not much at home for the first few years, okay? And that could be the right thing for you, but it's not always the right thing. So anyways, if you are still working, this is where it starts to get a little bit more complicated. So if you're 65 or older and still working, first ask, does the employer plan cover 20 or more employees, right? Do you have 20 or more employees on the plan? And if that's the case, you're gonna go one direction. So if the answer is yes to that, you can stay on the employer plan and delay enrolling in Medicare. However, you should talk to your benefits administrator to see if you should enroll in any part of Medicare, and you may be advised to enroll in Part A, partly because it's free and generally offers better hospital coverage than most employer plans, okay? But there is a very important caveat here, right? And this is where you get into the financial planning side. And you really want to make sure you're taking care of this the right way, because you can have penalties and taxes, which you don't really need to pay if you get this right. So if your employer plan is a high deductible plan paired with a health savings account, you will need to make a choice. You cannot contribute to your HSA if you are enrolled in any part of Medicare. And actually, you should probably stop making contributions to your HSA about 6 months prior to going on Medicare if this is going to be the case, to avoid any penalties. So if this is the kind of plan you currently have, you want to talk to your employer, because you may be able to have a different plan, or you could always go off the employer plan and get all of your health insurance through Medicare as well. So this is, again, could get a little tricky, and you want to base this on your situation. So let's go back to the question that if you are over 65 and working, does the employer plan cover 20 or more employees? If the answer is yes, we saw that you can delay enrolling in Medicare, but you should talk to your employer benefits administrator. And what if the answer is no? So if your employer plan covers fewer than 20 employees, then you must enroll in Medicare at age 65 in order to have complete coverage and avoid penalties. This is important. Remember the table we saw earlier of who pays first. If you are over 65 and covered by an employer plan that covers fewer than 20 employees, Medicare pays first, but you must be enrolled in Medicare for the Medicare to pay. So this is really, really important. All right, so number one, you have to enroll in Medicare if your employer plan covers fewer than 20 employees. Also, you want to talk to your benefits coordinator, because your health insurance at work may be different. Unlike the insurance you had before age 65, your insurance now will be designed to coordinate with Medicare. You may want to keep the employer plan for supplemental coverage to fill in some of the gaps that Medicare doesn't cover. But since Medicare will be the primary payer, you'll need to enroll in Parts A and B. Part A covers hospitalizations, and Part B covers doctor bills and procedures. Drug coverage works a little differently. If your employer plan offers coverage that is at least as good as Medicare's, called creditable coverage, okay? That's in quotes there, creditable coverage. You can keep the plan for your drug coverage, and you do not need to enroll in Medicare Part D. Your insurance company is required to give you a statement each year certifying that the plan is creditable. As long as you have that, you can delay enrolling in Part D, and you will not be charged a late enrollment penalty if you enroll later. If you ever lose your employer drug coverage, you should not go more than 63 days without coverage. If you do, you may be charged a late enrollment penalty. Okay? So I've just given you the rules for when you need to enroll in Medicare and when you don't. Specifically, if you're age 65 and working, and when your employer group plan covers 20 or more employees, you can stay on the employer plan and you do not need to enroll in Medicare. However, my advice to everyone turning 65 is to actually call the Social Security Administration and ask them if you need to enroll in Medicare. If you're working and covered by an over 20 employer plan, they will say no. You should make a record of that conversation. Let me say that again. You should make a record of that conversation, the date and the name of the person you talk to and a summary of the conversation, and keep it for when you eventually enroll in Medicare. There have been cases where people were advised by somebody other than a Social Security Administration representative, say an insurance agent or employer, not to enroll in Medicare. And then the person was charged late enrollment penalties. If you happen to get wrong advice from the Social Security Administration and are later charged penalties, you can seek equitable relief, but only if that bad advice came from the Social Security Administration, not from anybody else. So if you are not working or are covered by an under 20 employer plan, the Social Security Administration will tell you that you do need to enroll in Medicare and you should take their advice. All right, so late enrollment penalties. So here's the penalty I just referred to. If you don't enroll in Part B when you're supposed to, you will pay a 10% penalty for every 12-month period that you should have been enrolled. And that stays with you, by the way. You do not want to pay a late enrollment penalty if you can avoid it. This is why it's critical to get the Social Security Administration's guidance and advice when you turn 65. So here's a COBRA warning. Okay, so we saw earlier that COBRA pays secondary to Medicare, but I want to bring this up again because it is quite common for employees to go on COBRA for 18 months after leaving employment. The thing to remember here is that COBRA is not considered an over 20 employer plan. If you don't enroll in Medicare within 8 months after your employer insurance terminates, you may be charged a late enrollment penalty. So some people have come off of COBRA after 18 months and found out they couldn't go into Medicare right away. They had to wait until the next general enrollment period between January and March, with Medicare coverage not starting until July. So this caused a gap in coverage and a late enrollment penalty as well. So got to be very, very diligent with this and make sure you're doing the right things right around age 65, regardless if you're on COBRA, and make sure you're asking all the right questions, okay? All right, so now that you're clear on whether you need to enroll in Medicare and when, let's talk about how to enroll in Medicare. Really, it couldn't be easier. Just go to medicare.gov, click on the Get Started, Learn More About Medicare button. Okay, so that's this button right here, right? And the online application process is very easy and you'll be guided through it. I should say that if you are receiving Social Security when you're 65, you will automatically be enrolled in Medicare Parts A and Part B. You can decline if you wish, but the only reason to decline Part B would be if you're working and are covered by an employer plan that covers 20 or more employees, and if that's the case, you probably haven't filed for Social Security yet. Another way to enroll is to call the Social Security Administration at 1-800-772-1213, right? And your broker could probably help you if you talk to somebody like a medical insurance broker. Okay, so now let's talk about how private insurance works with Medicare to provide complete coverage. So even though Medicare is a government program, it is based on a private insurance model involving deductibles and co-insurance amounts. It does not pay for 100% of your care, and the Part D prescription drug plan looks to private insurance companies to provide the actionable insurance. So, enrolling in Medicare Parts A and B does not finish the job. You also need to find a private insurer to cover your drugs and pay for some of the deductibles and co-insurance amounts for hospitalizations and doctor bills. All right, so here are some of the ways that you can fill Medicare gaps with private insurance. First, look to see if you have employer or retiree insurance that works with Medicare. If so, you may want to keep it, but make sure the drug coverage is creditable, okay? Creditable, very important. That means that it is at least as good as Medicare's basic drug benefit model. Your plan will know if it provides creditable drug coverage. So, and it will give you a statement to that effect, by the way. So you should be receiving that in writing. If it is not creditable, which may be the case with some high deductible health plans, you should find a standalone prescription drug plan on the open market. Remember, if you go more than 63 days without creditable drug coverage, you will pay a late enrollment penalty when you finally do sign up for Part D. If employer or retiree insurance is not available to you, you have two choices. You can take out a medical supplement policy, also called a Medigap policy, and pair it with a prescription drug plan, or you can enroll in an all-inclusive Medicare Advantage plan. Medicare Advantage plans are like HMOs that involve a network of providers that deliver your care. So please note that whether you take out a Medigap policy or enroll in a Medicare Advantage plan, you still must enroll in Medicare Parts A and B. So can be tricky, right? And I'm not going to tell you what to do here on this workshop, but choosing between a Medigap policy and a Medicare Advantage plan is not always so easy. Once you've made the decision, you have to decide which Medigap policy or which Medicare Advantage policy to go with. And this is another reason the transition to Medicare at retirement can be so tricky. When you were working, the employer negotiated with insurance companies and narrowed down your selection of plans. You just got what they had as far as options for you. After you retire and go into the Medicare world, you're basically on your own. This is why I recommend partnering with one of the not big insurance companies, but one of the Medicare brokers to help you narrow down and decide on your plan. There will be many plans available to you. The reason why I typically refer out this final decision is because I used to help people because some states are relatively simple, but some states will have 30 plus plans to choose from. And so there's just so many plans available to you, and it's really up to you to choose the best plan for your needs. And so you may have some considerations that we need to think about that can be very unique. Specific drugs, time frames, health conditions, there's really a lot to think about. But the first thing you want to think about is, can you see the doctor that you want? Some Medicare Advantage plans have rather narrow networks, so there's not a lot of options. And if you go into one, you may not be able to see your same doctor. Same with specialists. To keep costs down, some Medicare Advantage plans are excluding the very specialists you might want to see if you were to encounter a serious diagnosis. With a Medigap policy, you can see any doctor that accepts Medicare and are not limited to an insurance company's network. So that could be a big part of your decision on how to make this decision for you. How much will you have to pay for your medications? Drug plans differ widely in what they will pay and what they require you to pay for different types of drugs. So when you are shopping for a drug plan, you will want to make sure you take your own drug regimen into account and see how much you would pay under each plan for the drugs you take. If you don't take any drugs on a regular basis, you can just go with the plan charging the lowest premium. You can always change it after a year. So again, these are things that are going to be unique and specific to you. Second consideration here, what are the monthly premiums, right? Medigap policies tend to charge higher monthly premiums than Medicare Advantage plans. But you can't look at premiums in isolation. Choosing a plan based strictly on the monthly premiums could come back to haunt you in the end. Plans that charge low premiums often have higher out-of-pocket costs, such as co-payments for each doctor visit or high co-insurance amounts if you have to go out of network for your care. So just be sure to take into account all the potential costs based on your own healthcare usage when choosing supplemental insurance to go with your Medicare. I really do recommend, like I said, I'm saying this over and over today, but I really do recommend speaking with an insurance broker to help with this decision. You will not pay any more for the policy you choose and will most likely have a more tailored plan selected. So how much can you expect to pay after going on the Medicare? Sometimes this can be a shock for people, so I wanted to talk about it with you. In addition to being prepared for the work and handling your own insurance in retirement, you also need to be prepared for the costs. Unfortunately, many people retire without knowing how much they will pay for health insurance and health care in retirement. And as I mentioned earlier, when your employer is subsidizing your premiums and when your cost-sharing amounts are taken right out of your paycheck, you may not even be aware of what you are paying while you're working. And it will be different after you retire. So let's take a look at this in more specific detail. Okay? So here are the items you have to budget for in retirement. First are your monthly premiums for Medicare and whatever supplemental insurance you choose. Second are the out-of-pocket costs for healthcare. These include your deductibles, co-payments, and co-insurance amounts. In other words, the gaps not covered by your insurance. Some of the gaps left by Medicare can be covered by supplemental insurance, but not all of them. There will also be out-of-pocket costs for non-covered services, things like Medicare and supplemental insurance do not cover at all. So a lot of things to think about here. Okay, now, this gets into some of the financial planning side, potentially some of the tax planning side. Okay, so if you have our 2025 important numbers that we offer to everybody when they come into the group, I send it out every year by email to folks on our email list. If you want it, just reach out to me directly. I'll give it to you. But we have the updated table here for the monthly premiums for parts B and D, included income-related adjustment amounts, right? Also known as IRMA. So income-related monthly adjustment amount is what IRMA stands for. Right? So this table shows the Part D and Part D premiums for different income levels. If you're single, okay? If you're single, right here, and joint. So here's single and joint, but single, and your income is under $106,000, and that's all income, okay? MAGI. Or if you're married and your income is under $212,000, you'll pay the regular Part B premium and the regular Part D premium. Okay, so the Part B is $185, right? So there's no IRMA here, right? And there's no Part D IRMA here. So the total amount for the Part B and D premium would just be that $185. Okay, you might have to pay a little bit more for your drug plan. Now, this is where it gets tricky. Okay, you go above that, then your income's going to fall into one of these other tiers. So something that I see and that I talk a lot about with some of the clients that I work with, because to be honest, we get people that come in with pretty large pre-tax IRAs. So pre-tax IRAs, 401ks, which as we all know, and maybe you don't or maybe you do, but there's something called a required minimum distribution that's going to have to start coming out of that account. So for some people it's 73, for some people it's 75, but at some point any pre-tax accounts are going to have a distribution requirement on them. Okay? So when you are, married filing jointly, very few people get into this $212,000 or above. I'm not saying it doesn't happen, because it definitely can happen. But the $106,000 could be something you have to be concerned about. Okay, so when you get to this second tier here, then you're going to pay your Part B monthly premium, right? But then you're also potentially going to have to pay a Part B IRMA penalty, which is $74, and there could be a Part D penalty for IRMA, which would be $13.70, which makes your Part B and Part D premium go from $185 to $272.70, and this is per month. Okay, and the thing about these IRMA brackets here, it's not like your tax brackets where if you go from, let's say, the 12% bracket to the 22% bracket, only the dollars above that get taxed. How this works is if you're $1 over, you pay the full premium for this next IRMA bracket here, okay? So again, these are things that when it comes to your financial planning, you want to make sure you're taking into account your whole situation when you're looking at your healthcare, because like I mentioned earlier, it may make sense to take a little bit of hit on the subsidy and pay a little bit more subsidy if we could do some Roth conversions early when you have no other income and get some more money that will not be part of your required distribution later, right? So these are things that, again, it should be very individualized and need to be kept in mind because these are per person. So, if you're a couple, actually, then what happens is these amounts double, right? So instead of 74 just for one person, it's going to be 74 for two people. And that can really add up pretty quickly, right? So how this works is it's a 2-year look back, 1-year penalty. So your tax return from 2 years ago is used to determine the income-related adjustment. So for example, for the adjustment for 2025 will be based on the income reported on your 2023 tax return. And keep in mind here, the premiums shown do not include premiums for drug plans, Medicare supplements, or Medicare Advantage plans. This is only for Part B and Part D. So this can actually get quite expensive. So if you look here, you go from 106 to 133. This is IRMA bracket 1. Okay, so that's $74 for your Part B premium and $13.70 for your Part D. You go $133,001. Now your premium here jumps to $185 plus $35. So now you're at $405 per month. Okay. So these are things, again, you really want to make sure you're taking into account your whole situation and make sure that you are planning not only early for these types of penalties and required distributions for your retirement accounts, but for those later years, especially if you're married today and you have, like, let's say pensions, you have a large Social Security amount, and you're expecting some sort of decent RMD from your retirement accounts, you can hit these brackets pretty quickly, and it can be very, very painful down the road, right? So what should you be thinking about here when it comes to what you might pay for your supplemental insurance? So I've indicated some typical amounts here, which is around $200 a month for your Medigap policy, plus another $40 for your drug plan, or about $50 for a Medicare Advantage plan. You can find plans with fewer benefits at lower cost, as well as plans with more benefits at higher cost. Choosing a plan based on your own expected healthcare usage is what you are tasked with at retirement. But if you just want a ballpark idea of what you might pay for health insurance after retiring, you can plug these numbers into your preliminary budget and then just make the adjustments later. If you have good supplemental insurance, your deductibles and coinsurance amounts for hospitalizations and medical services may be mostly covered. But there still may be some co-payments each time you visit the doctor to get your prescriptions filled. And then there are services that Medicare doesn't cover, and these can be a little bit controversial. And that Medigap policies don't cover, by the way, either. So this includes dental care. So with dental care, in my experience, what I found is for most people, it can make sense to just pay out of pocket, because if you get medical insurance, you're paying that monthly premium, you get a certain amount of coverage back. So it's usually around $1,500 to $2,000, but you might pay $150 a month, right? And then what happens is the dentists have to go through the billing process, which takes more time and more manpower. So without any sort of dental insurance, you could have gotten the same price after insurance as a cash price, and then you save yourself the monthly. But if you can get into some sort of group plan, I've heard some people do group plans that work through either certain organizations, Delta Dental, some things like that, then it might make sense to look at paying for dental insurance. When it comes to things like, vision, hearing, and alternative care, again, these are things that's, just your routine vision and healthcare and alternative care, such as acupuncture and chiropractic. Some employer or retirement plans do cover these services, and some Medicare Advantage plans cover them. But if you choose a plan that is right for you in other ways but doesn't cover these services, you'll need to incorporate these costs into your budget, right? So my hope is that this is not overwhelming you. It's just opening your eyes to helping you really understand that you need to sit down and plan and start doing these things early so you don't have a big shock and surprise when it comes to paying for this. This also aligns with some people making their decision on when to take Social Security, because at age 62 versus your full retirement age, you're going to get about 30 to 35% less Social Security. And if your Medicare cost is getting taken out of that Social Security and you have a smaller income because you took it early, this can really be painful. You can really feel that bite. So again, all part of the decisions on how to retire and when to retire and when to claim some of these things. Right, so here's a sample budget showing monthly premiums only. This is for an individual who is not subject to the income-related monthly adjustment amount, which is IRMAA. So they're paying the base Part B, right? This is $185 per month. Their Medigap policy will be $200 a month, and the drug plan will be $40 per month for a total of $425 per month. So let me ask you, maybe anybody watching can put it in the chat. How does this compare to what you're paying for your employer insurance now? Is it lower or higher? Some people actually save money after going on to Medicare, and others spend more. It just depends on how generous your employer was while you're working. For those of you that are self-employed, like myself, we pay top dollar here, so you can definitely be getting a discount from an average policy here for a family going on Medicare, but it all depends, like I said. So here's a sample first year budget, take into account premiums and other out-of-pocket costs that could come up, and this will be for a person who has the most comprehensive Medigap policy, okay? There would be no deductibles or co-payments under this plan. There would be out-of-pocket costs for dental, vision, alternative care, and miscellaneous costs. And these costs will vary for each person. So yours may be higher, but for now, we just want to get you thinking about what your own first year health care costs might be. And really to not just retire until you know how you're going to be paying for them, okay? Because this, obviously, look how expensive this can be. This could be a lot more than people are thinking about, when it comes to their health care, right? Okay, so transitioning to Medicare. I know that each of you is in a different place with regard to retirement. Some of you may already be retired and others are planning far ahead. But the first step is to determine your Medicare effective dates. So this will either be the first of the month you turn 65, or if you are still working and covered by an employer plan that covers 20 or more employees, the month you go off the healthcare employer plan will be your effective date. So what I recommend is about 3 to 5 months before that effective date. Find out if you will have employer or retiree insurance available to you and understand how that insurance will work with Medicare. If you are keeping the employer or retiree insurance for a supplemental coverage, enroll in Medicare Parts A and B and ask about enrolling in Part D. If the plan offers creditable drug coverage, you may not need Part D. But don't enroll in Part D unless instructed to do so by the plan. If you are not keeping employer or retiree insurance, decide between a Medigap policy paired with a prescription drug plan or a Medicare Advantage plan. I highly recommend you shop for plans, choose one, and apply for coverage starting on the effective date and enroll in Medicare Parts A and B and D starting on the effective dates. Then, annually in the fall, okay? Once you have made the transition to Medicare, your job is not quite over. This is important, okay? So this is something you want to take a note on and put something in your calendar to check on this because this is a gotcha, right? Some Medicare plans change every year. Medicare Advantage plans change their pricing and terms based on their outlook for healthcare costs in the year ahead. They may raise the premium or kick your doctor out of the network. It is very important, if you have a Medicare Advantage plan, to review the materials when you receive them in the fall and make sure your decision between October 15th and December 7th of each year as to where you want to stay in the plan or switch to a different one. Okay, very important. If you had decided to go with a Medigap policy, that policy itself won't change, but the drug plan you choose to go with might. Okay, this is again important. They might start charging you a different amount for the drugs you take. So you should review your drug plan materials each fall and decide if you want to stay with the same plan or switch to a new one for the next calendar year. Remember, reviewing your existing plan is only part of it. New plans come onto the market every year, so you want to see what else is out there before deciding to stay with your current plan. The insurance companies know that most people tend to stay with their plan, so they use little tricks like upping the co-payments or raising the premiums while offering more attractive plans to new buyers, assuming that their existing members won't bother to look at the newer plans. So in reality, you have to be vigilant in the Medicare world or you will end up paying more than you need to. Okay, so hopefully you found this helpful. I really want to thank you for joining today and coming in to learn, and for everybody that's watching this live. If you're watching this later, that's great. You can definitely ask questions. You can send an email here to me if you have any questions. The unfortunate thing about Facebook now is they're going to be taking down any live videos after 30 days. So I am recording this, and then I will take it, have my editor edit it, and then I will re-upload it. Okay. So if you're thinking about watching this video and you're busy and maybe you want to come back to it, and then somehow 30 days goes by, it is going to disappear because that's just the policy Facebook has now. It just is what it is. But I will have it edited. It usually takes a few weeks, and then have it re-uploaded here so you can watch this later. I think this is going to be a very foundational video and training everybody needs to watch prior to going to retirement and getting on Medicare. So we'd love to help you. If you need some help with all this kind of stuff, I do offer a free retirement analysis. We call it our Retirement Vision Discovery Call to get started. And then you can also just go to my website and just go to keepitsimplefinancial.com, and there's a 15-minute intro call option. If you just want to chat, have a quick discussion, say, hey, does this sound like we'd be a good fit? I really love to speak with you. Our office number is there as well. It's 877-673-8473 or 8776-RETIRE. If you have any questions, feel free to call in. And my email is there below, info@keepitsimplefinancial.com, if you want to ask any questions to me directly. So that's pretty much what I have for you today. So like I said, I really appreciate y'all watching. It's really nice to have folks come on to learn. My passion is education. We were talking about this the other day with my wife. She was asking me, it really seems like you love doing what you do. And honestly, I really do love this work. I find a lot of joy in it, and you're just helping people all day. I really love it. But she said, well, what would you do if you were not a financial planner? I said, you know what? I'd probably be, I always wanted to be a professor at a university. I went to UC Irvine. I studied chemistry, engineering, and political science. I just love learning and I love teaching. So getting to do these workshops, helping people, I really enjoy it. And then hopefully some of you get something out of it, and we actually help you improve your financial life. And then, I just figure if I help enough people, then everything else will take care of itself. So let's see if there's any questions here in the chat. And if not, then we'll wrap up for today, okay? Yeah, so Pam said much higher. Pam, I'm guessing you're talking about the cost of the healthcare, right? Probably much higher than expected, right? Sean, you're welcome for the presentation. I appreciate that. Michelle, you're welcome as well. Tim, you're welcome as well. Chris, thank you so much for watching. Nanette, thank you for joining. You're welcome as well. So I'm not seeing any questions, folks. So if this comes up later, you have questions, reach out. Once again, my name is Jason Hamilton, the founder of Keep It Simple Financial Planning and the admin of this group. Thank you again for showing up. We have a lot more coming this year. So what I recommend for you after this, go into the guide section, download that retirement planning checklist, because my goal is to get through as much of those items on that checklist as we can this year over the course with all of our presentations. So mark this down. If you need to go back and watch this today, that's great. And but get that checklist out, print it out, and make sure you're addressing all of those items before you make that big decision to transition from work to retirement. And if you need any help with it, we're here to help you. And we'll see you on the next one. Okay, have a great Sunday, folks, and we'll talk to you soon. Bye now.